Hello. So, uh, I'm going to discuss about a case, but it's not a case presentation. It's actually my own experience, my personal experience in my psyche, in my mind, which I experienced while giving a therapeutic session, hypnotherapeutic session to one of my clients. Uh, and I think that personal experience which I had carry lot of significance in hypnotherapy. And also, I'm not very sure whether this presentation is going to be very scientific or it will be little bit beyond the boundary of so-called science. As such, also, we are all working in the field of psychology, which is not exactly befitting with the definition of material science. It's not as scientific as the science of physics or the science of chemistry or the science of mathematics. So, the science of psychology, which we are all practicing, it is more closer to the spiritual science. Of course, it is a little bit more scientific compared to the spiritual science. We don't consider the spiritual science to be anyway scientific. Anyway, so it's between the material science and the spiritual science, and it will be um, like that. My this presentation also may not be fitting exactly into the science of psychology. Also, perhaps it may go towards spirituality and other things. But anyway, let me share my presentation and begin with today's presentation. So, you all know that my institute, Samatvam, is now online institute. The samatvam.co. This is the URL for this online institute. And what I'm going to talk about is my interesting experience, which was very interesting for me. And I, I'm, I'm hopeful that it may be interesting for you too. So it is an interesting experience of conducting a couple of sessions, especially one particular session of hypnotherapy with a patient of gender dysphoria. So let us begin with what is gender dysphoria. Gender dysphoria is a feeling of distress that can happen. The person may experience that feeling when the person's gender identity differs from the sex assigned at birth. Gender identity is internal sense of being a male or female. So that identity in the mind, maybe there may be a sense of being male, but actually the gender of that person is female, or vice versa. So that is called gender dysphoria, the feeling of distress due to this disparity between the gender identity and what actual sex of the person is there since birth. Around 50 to 70% of transgender people experience significant level of gender dysphoria at some point in their lives. So all the people who have this problem of transgender phenomenon, all the transgender people do not suffer from dysphoria. And the figure varies widely from 50 to 70% of them suffer from significant symptoms, significant severity of symptoms of distress during their lifetime. Especially, most of the people suffer during the later part of adolescence, later adolescence or mid adolescence. Other transgender people feel very mild discomfort or no discomfort at all with their bodies and the gender identity difference. They are not very much upset about it. They have accepted it naturally, and they don't have any gender dysphoria. So gender dysphoria is diagnosed uh, according to DSM-5, and it includes stress due to gender dysphoria, like stress due to gender identity differing from the sex assigned at birth that lasts at least for 6 months. That distress has lasted for more than 6 months, and it involves two or more of the following symptoms, following criteria. So, what are those criteria? A difference between gender identity and genitals or secondary sex characteristics. That is the primary characteristic need for diagnosis of gender dysphoria. Then a strong desire to be rid of genitals or secondary sex characteristics, or a desire to prevent the development of secondary sex characteristics when it starts in the early puberty, when the secondary sex characters are yet developing. Strong desire to prevent those kind of, because they feel something different, others sex they feel. A strong desire to have the genitals and secondary sex characteristics of another gender. They have that desire to have it. A strong desire to be or to be treated as another sex. So the male child would want the people to treat, if the child is suffering from gender dysphoria, person is suffering from gender dysphoria, the person wants him to be considered as female, even if he is male, or even if he is female, that person, she wants her to be treated as male. So there is a strong desire for that, craving for that, a strong belief of having the typical feelings and behavior of another gender. And gender dysphoria also include distress that makes it hard to handle the work, handle the school life or social situations, and in various other parts of their life also. So these are some secondary symptoms the person would feel. But out of these five criteria, if two are present, it is diagnosed as gender dysphoria. Okay. Now the case about whom I'm going to talk, that person's parents approached Samatwam and met me in 2007 with their daughter named Ria. I have changed the name, of course, for presentation. So they brought Ria to me at the age of 15 years. Ria was 15 years at that time, who was feeling unfit for the gender which she was born with. And she had constant anxiety, lot of irritation, and complaints to the parents about being a girl because she wanted to be a boy. Now, as I was not so experienced with working with these gender dysphoria patients, so after initial history taking and little bit of counseling of the parent, they were quite anxious about this thing. So after that counseling, we refer the patient to healthcare professional with expertise and experience in the care of gender diverse people. After so many years, after about 13 years after that, the parents contacted me telephonically in 2020, and they conveyed that they consulted several experts who are working in gender with gender diverse people in Bombay as well as other parts of the country. And finally, they decided for gender affirming surgery, masculinizing surgery for this particular case, because she's a girl and she wants to be a boy. From feminine, she wants to be a masculine. So, masculinizing surgery, it is called gender affirming surgery. Now, this boy, when he consulted me recently, last year only, he consulted me in November 24. Then, at that time, in November 24, he gave me his history of what happened between 2020 when they decided to go for surgery and now. Within these years, 4 years, what happened. So he conveyed me. So now he had become Rohan and male gender. So he conveyed me that the first stage of surgery was conducted in December 21. And in this first stage, they do total hysterectomy. So laparoscopically, they removed her uterus, fallopian tubes, and ovaries. So internal sex organs were removed. Cervix and vagina, they are the vagina and the cervix. These are the external sex organs, female organs. So they are not removed in the first stage. So the first stage is removal of those internal sex organs, the organs for um, carrying the child and that female reproductive system organs. So they were removed. So that was first stage, and he underwent. She underwent it in December 21. But then this patient required reopening of the surgical wound in September 22. After about 10 months, he required reopening of the surgical wound due to complaint of constant feeling of pain inside her vaginal part. So um, they consulted many specialists, and the people who carried out the surgery, they thought of opening it and looking into it because other investigations were not showing anything significant for this pain as a reason of pain. So they opened it, but no obvious pathology or structural complications were found. And there was, they did restitching, and they conveyed that there is nothing abnormality inside. The operation is quite good and successful, and your pain may subside over a period of time. So nothing to be done, something like that. Then he underwent second surgery after 1 year of the first surgery in December 22. That is known as top surgery. So in top surgery, they do mastectomy and breasts are removed, and they give male counter to the male counter chest to the person. So by extending the pectoralis muscle and covering it and like that, there is a surgery conducted, which is known as top surgery. So he underwent that also. The third stage of surgery, that is pending, in which they do vaginectomy, scrotoplasty with insertion of testicular prosthesis in that newly constructed scrotum, and phalloplasty, that is construction of a penis the male sex organ. So these three things are done in the third phase of surgery, and that was pending. And he conveyed me that most people do not go for this surgery because of lot of high risk of complications of the surgery. So most of the people they don't go for that. And at that time, Rohan also decided that he's not going to go for the third phase. He's satisfied with these two changes in his body. But what was bothering him, uh, yeah. So when he consulted me, he gave all this history. He consulted me last year, November 24, as I told you. He is 34 years now. So what complaint brought him to me now is the complaint of the same pain, pain in his vaginal part, which is still there in his body. Um, the pain is moderate to severe sometimes, and it's a biting type of pain. He described it as चुभन वाला पेन. चुभन हो रही है अंदर, biting कुछ हो रहा है, ऐसा पेन है. For last 3 years, after the first stage of surgery only, it happened and it continues. The pain becoming very severe when there is any type of fast movement of his legs. So even in the sitting position, if he wants to move little here and there, he need to be very careful while moving the legs, while walking, while standing up from sitting or sitting down from standing. So all these leg movements, he need to be very careful and slow, otherwise there will be very severe pain. Uh, they consulted many different specialists because for this pain, but no organic cause was found. And actually, as I told you in the previous slide, we have seen that the opening of the wound site and restitching was done about 10 months after the first surgery. And that was done for this complaint of pain only, but nothing specific was found out. He also informed me, Rohan informed me, that he participated in my workshop, transformation workshop, which most of the participants, most of my clients participate in that. He, so he participated as Ria when she was 24 years old. So he knew about self-hypnosis and he then later on practiced it also for some period of time. So all these histories he came. So in this particular session number one, the, like the first consultation, because he had already undergone transformation and he knew self-hypnosis, so I directly taught pain management techniques. Two techniques I taught him: ice melting technique, that is to be used while actually experiencing the pain. So whenever there is more pain, he can do that technique to subside the pain. And another technique I taught is symptom substitution. So the symptom of pain was substituted by coldness, so feeling of cold. And that is to be practiced once in a day, every day, regularly. So we expect the pain gradually get transformed into the sense of cold. And during the session, he could feel that cold sensation in the hand, and then it was transferred to the pelvic region, the vaginal part, and all these, he could feel that also. And also, I suggested, apart from this, which he has to do regularly, I suggested him to practice either PMR or ego purification on alternate days, both these techniques. So that was session number one. In session two, which he took appointment on 21st December 24, he reported that hardly 10% reduction in pain is felt. So it was not very significantly useful to him, these pain management techniques. He felt that old sensation for that symptom substitution technique that was felt outside skin only, but where he had actually pain inside the vagina, there was no relief, and even the pain used to increase after some time. So he was not feeling comfort or any relief from the pain by this symptom substitution. And ice melting also, he tried several times and got benefit. The pain used to reduce a little bit. Perceptible reduction in pain used to be there. But then after an hour or so, the pain would increase and it will become more severe. So he stopped using that technique completely after using for several times. And this he continued, but he could not find any change. So this was his um, feedback of his practice. Then in that session, second session, I decided to go for ego state therapy. So I explained about ego state therapy, whatever preliminary instructions are required, and conducted the ego state therapy session. Ego state was activated, which was ready to talk to me about Rohan's problem of this pain. And, in ego state, we invite the ego state if there is any part of the mind which may be some way related with or responsible for this kind of symptom. So an ego state was activated and ready to speak to me about Rohan. But during the entire session, at times that ego state was talking regarding Rohan huh, as the third person. So Rohan became the third person, and that part was talking to me. And at times, that ego state became Rohan, and he became second person also. So it was partly a regression type of thing as well as ego state. Both the things kept on happening throughout the session. So what came out? So that ego state describes something like this, that when Ria was desperately wanted to go for surgery and she was actively doing research about it, her parents were reluctant because they were concerned about risks of complications of the surgery, and also they were concerned about the comments by the other relatives and the other social their social contact, their society also, how people would look at him as a boy because he was a girl, and all those kind of concerns were there in the mind of parents. That is what this ego state is conveying to me. So they used to accompany her for consultation and they were trying to cooperate, but according to that ego state, they were not so happy with what she had decided. So this statement was repeated that they were not so happy. I could sense that they were not happy with this decision of Ria. And it is that time that I was created in Rohan's mind. That is what the ego state is conveying to me. That ego state is saying they permitted her just for her happiness, permitted for the surgery for her happiness, and finally now they don't see Rohan happy. Even after surgery, after um, um, successful conversion into a male gender, he is not happy because of this pain and this suffering. So parents are actually more unhappy. And because he made his parents unhappy, this ego state is telling that Rohan should be feeling guilty about it and he should be punished for not listening to the wish and the advice of parents. Otherwise, Ria was a very nice and very obedient girl, always making parents happy with her behavior. But this time, she did not listen to the parents' advice. So the part repeatedly said during that session that this pain is Rohan's punishment and he deserves that punishment. So this was the outcome of that session. Uh, I explained to that part that Rohan has taken the punishment for enough time now. And now, if that part stops punishing Rohan and allow him to be happy about being boy, naturally the parents are going to be happy. Because now the parents' unhappiness is seeing him suffering even after the surgery. So I tried to convey to that part that this whatever parts are activated, they have a childlike thinking sometimes, not very logical type of thinking. So I tried to put this logic that it is Rohan's suffering what is causing unhappiness to parents right now, post surgery. Otherwise, if Rohan is happy with the surgery, they are also happy. So now let the part stop punishing Rohan and let Rohan be happy so that the parents also are going to be happy. So after some arguments, the part agreed for that this proposal, provided, so the part demanded something, provided Rohan discuss the whole thing with parents, apologize, and confirms from the parents that they have happily accepted the decision wholeheartedly and they are not feeling embarrassed by comments of any other people also. So till now, Rohan never discussed this guilt feeling with the parents. So the part wanted that Rohan should discuss the entire thing. Why am I punishing? And I should be convinced, I should be assured by the parents that they are happy and they are no more embarrassed. Then only I will stop um, giving this punishment to Rohan. So that was the clear-cut demand from the part. And I assured that part on behalf of Rohan and on my behalf also that yes, it will be done. We will see that it is done. And the part was instructed to go and settle in Rohan's mind as we terminate this ego state therapy session and convey to the part that the part should help in the process of complete healing, comfort, and happily progressing in his life. The part should help Rohan in all these things. The trance was terminated. Rohan had complete memory of the entire session, so there was no amnesia. He remembered what happened, what the part was talking, and all. Sometimes he himself was talking as second person, and sometimes Rohan used to become third person, as I told you, but he remembered everything. And he requested me to allow the parents during his next session. And he would like to talk to the parents in that session in my presence. That was his request. So we decided to do so in the next session. That was second session, then third session. During the third session, which was arranged in January 25, the first statement from Rohan's father, before we started discussing anything, the first statement by the father was, we and all other elders in the family, we are all very happy to have a ready-made male child. And he explained me why I am not that gender biased, but my parents and my wife's parents, our elderly people, their mindset used to have the gender bias and they were very happy कि चलो आपको तो बेटा नहीं था तो बेटी में से बेटा आ गया आपको. So they were more happy to have that male child. So there was no negative comments from them. And all other relatives also are, matlab they accepted. But we can see that Rohan is not so happy even after fulfillment of his wish um, to be a boy. So Rohan believed that parents are not happy, and parents believe that Rohan is not happy. Okay, because of this suffering. Otherwise, they were very happy and satisfied with whatever decision was made and whatever treatment was done. Upon Rohan's asking about this was his comments initially only, but now Rohan is discussing upon Rohan's asking about their resistance. That then you were denying and you were resisting my this going for surgery. His father conveyed that their reluctance was only for initial few days, when they were not much aware of what the entire surgery and outcome and all these things are going on, or they are going to take place. So it was for first few days, but as they met different experts and understood the indication of surgery for their child, they were very happy wholeheartedly. They supported him, and everybody in the family and their social circle also appreciate the decision, and they are proud of Rohan and very happy and very satisfied. So this was clearly conveyed by the parents in that session, and they mutually shared their happiness. So after these 3 years, Rohan had another guilt, not only guilt of having undergone the surgery against the wish of the parent, that was there. Another guilt was having still suffering. So he felt very happy to listen to this from the parents. They were now only concerned about the physical pain causing suffering. But Rohan was sure, he conveyed in the session that I'm sure that eventually this will go away and I'll be fine and I'll be enjoying being a man. The father also pointed out that, okay, Rohan should also work on his self confidence and assertiveness because he's lacking in that. He's lacking in self confidence and assertiveness. So he requested me to help him in that area also after this pain is handled. So there, the session number 3 was it was a family meeting, and then Rohan um, took an appointment on 18th January, within a fortnight, 1st January, and then 18th January, he took next appointment for himself. It was session 4 with him, and he complained that the pain is still having the same fluctuations, sometimes becoming very severe, sometimes moderate. And he told me that generally, for about 2 to 4 weeks after every session, he would feel little relief, but then the pain would reach to the original severity. So by now, it has happened like that in last 3 to 3 months when he's practicing everything. There is a relief, little bit relief for 2 3 weeks, and then again the same thing happens. So this not helped much because in that session of ego state, and then after when the things were settled with parent, I and he and parents, everybody expected that now his pain should go, but the pain was still there. Okay. In that session, what I did, because whatever insight was created, that was not integrated yet. So in this session, this was for integrating what insight was developed. So I conducted a translation for that. assimilation of that insight in his subconscious mind. So the suggestions were given for integration and harmony among all the different parts of his personality. And it was conveyed in the trance also that parents are happy and satisfied and proud of him, and no need for any self punishment now. And let all the parts start loving him, so loving himself and taking care of his body and mind, and complete healing and comfort in that vaginal part. So these were the suggestions around these ideas. The suggestions were given in this session of trance. I recorded that session and suggested Rohan to do this regularly and also continue doing PMR and ego purification once or twice in a week. Hmm? So that was session number 4. Now I'm coming to session number 5, about which actually I wanted to talk about my feelings. Rohan took 5th appointment after 3 months. He took appointment on 19th April last month. He told that pain was significantly less for 1 month after the previous session. But then it started. It started with the same severity, little movement causing very severe pain. So, he started losing that trust or that confidence in this therapy which was going on. So he was delaying the appointment. And in between what he did, in between he approached a Reiki expert. And that Reiki expert was popular for doing past life regression therapy also, a healer. So he approached that person and he inquired about past life regression therapy and Akashic record reading, both these methods. And that person explained that because Rohan wanted to know that in past life regression, if I undergo, is it very sure that I'll be able to recall something from my past life which may be responsible for this and all this? Then that person told that expert told him, a Reiki expert, that no, it won't be that way in every case. Some of them recall, about 50% of them may not recall also, or there may not be anything significant. And then he inquired about Akashic record reading. That also that person used to do. I was not aware of this, what it is. I came to know from Rohan only. That is also a healing technique used by many people. So that person told that in Akashic reading, I'll be able to say you what was there in the past life, and you will have that clarity or insight. So Rohan preferred that Akashic record reading. And that person did it, and he then informed, gave that report of Akashic record to Rohan. And his report was something like this, that Rohan was, in his past life, he was a man and he raped a girl and then murdered that girl and was not caught by anybody till he died. He was so smart enough that he disposed of that dead body also. Rohan categorically spoke, because that person might have spoken that word, that उसको ठिकाने लगा दिया था, उसकी लाश को मैंने ठिकाने लगा दिया था. So nobody could catch me till I died in that. So that was the report by the Akashic reading. The transgender life in this birth and suffering with this vaginal pain, even after successful surgery, is the result of his past life with this crime of causing suffering to that girl. So this was the report of Akashic record reading. Now this knowledge, and that was only this was informed by that healer. No further discussion took place. So this knowledge created very negative self-image and severe guilt feeling in Rohan. He was depressed and wondering, how can I do that? I cannot even think of killing an ant. And he, was I so bad in my past life? So he started feeling more severe guilt, more depression. So what I did in that session, I integrated the insight of Akashic record reading in his side. And that is what I wanted to share with you because I found that the things happened. Somehow I never thought of doing the work like this, but in that session, while conducting then counseling and therapy, I did three things. The first thing which I heard from Swami Paramatmanandi, I attend his regular discourses online every week. So in the last week session only, I heard Swamiji talking about this, that God is both karma phaladata and shuhud. Shuhud means kind and compassionate towards everybody. So, according to your past life karma, there may be a punishment also. If your karma were bad, if your deeds, if your actions in the past life were bad, you may get punished also. But at the same time, that punishment is not to make you suffer. The punishment is for your upliftment because he is shuhud also. So he do not do anything bad to anybody. Intention is never bad. So God's intention is always good and not to harm you even while giving you unfavorable situations. So unfavorable situation God need to give you because that is the rule which he has to follow, that because of your past sinful action, they in this life you get unfavorable situations. But then those situations are not given you to cause suffering. These adverse situations are given to you as opportunities for your growth. And you need to learn out of it, do good karma in this life, and that can grow you out of the suffering and grow you as an individual in your spiritual journey. So, this I conveyed to him, and I found some spark in his eyes, a smile on his eye, on his face also. Then I remembered another thing. This thing also I heard in one of the YouTube videos by Swami Premananda, to whom also I follow for last few years. So I heard from Swami Premanandi about a story, and that I conveyed to Rohan, because I found it very relevant and useful at this juncture in Rohan's case. So it is about how difficult it is to overcome the sensual pleasure, especially the lust for sexual pleasure. So it was conveyed that it is very, very extremely difficult. You know, in the spiritual path, they told about gradually growing out of the sensual pleasures and interest in that. So, seeing something or hearing something, eating something gives you happiness, but then gradually you overcome those limitations, and whatever is eatable, you enjoy equally. Whatever you see, be let your mind be comfortable and that in balance. So these are kind of spiritual practices they suggest to grow out of their like and dislike in relation with all the senses. But then the story what he that Swami Premanandji told us on that day that was the story of Jaimini Rishi and his guru, Badarayana Rishi Badarayana. So Rishi Badarayana was a guru of Jaimini Rishi, and in the story he also conveyed that Kamadeva is the deity for love, lust, and sexual pleasure. That Kamadev is very strong, very, very powerful, because Kamadev is son of Vishnu and Lakshmi. Hmm? So he has got a lot of power. Other sensual pleasures one can grow out, but this pleasure, it takes very, very long time. So the story goes like this, that Badarayana Rishi, he wrote a verse, no? A Sanskrit sloka, conveying that the urge to have this pleasure of sex, that is extremely difficult even for sadhak, even for brahmacharis who are on the path of spiritual growth, until the person achieves that brahma jnana, that ultimate salvation or enlightenment. Till the person reaches to that level, one need to be very careful about this, because that is very powerful, because it is by Kamadeva, who is very powerful. So this sloka was written by Badarayan Rishi, but then Jaimini, the student, he was not very comfortable with what Guru has told in this sloka. So he started asking that I actually believe that it is not that difficult. I have not reached to that level of Brahma Jnana yet, but then for many years I am observing Brahmacharya, and I don't have thought about a girl or having sex or anything. And all other colleagues who are studying with me, we all are following Brahmacharya. So I think it is little too much you are talking about this particular craving. So Badarayan Rishi, the guru, he is telling that, okay, I'll answer your this doubt. I'll give resolution to this doubt after some time. Wait for some few days. After couple of days, Badarayan Rishi told to all the disciples that he wanted to go out for some period of time, and in his absence, Jaimini would manage the affairs in the ashram, and you all discuss whatever you have learned, and Jaimini will monitor the things. So he was made the leader. He was otherwise also very senior to all other disciples. And Badrayan Rishi went for some work for a few days. After a few days, when these disciples were discussing on some topic, spiritual topic, suddenly one girl entered the ashram, and a young woman, and she was crying, and she requested Badrayan Muni and other people there, please give me shelter. And there are some people who are after me to take my life and um, to harass me. So I am running, and I have come here. So please give me some shelter. Now, Badrayan Rishi told that no, we cannot allow any girl, any woman in the ashram, and especially during night time, you cannot stay. And it was already evening. But then that girl was crying and requesting. So, with compassion, hmm, and they were not allowed to see the person also. So they were looking, all these disciples were looking down, not looking at the face of this girl. Badra and Rishi also. But then he told, ki, okay, you are so much in pain, and we should give you shelter at least for one night. There is a There is a small hut in one of the corners of the compound of the ashram. So there, this people will make some arrangement for you to stay overnight, and you go there. Don't bother. So that girl was sent there in that hut, and Bhadra and Rishi, the discussion was over, and they went into their own place. In the night, Bhadra, Jaimini Rishi. So Jaimini Rishi, he was, he had repeatedly thoughts of that girl only somehow, and he remembered the feet of that girl because he had seen the feet. So he remembered the feet; they were very beautiful. So there were thoughts in his mind that the girl having so beautiful feet, how beautiful that girl might be. So he had some desire to go and see that girl. So he could not sleep. So in the midnight, he went there. Now, in the evening, when the girl was sent to that hut, Jaimini Rishi very strictly instructed the girl that see, you'll be safe inside. There will be some arrangement for you, but then keep the door locked from inside and don't open it. Whosoever comes, even if I come and tell that I'm in Jaimini, then also you don't open. So don't trust anybody and keep the room closed only. And in the morning you go away. So that was instructed. Now, Jaimini Rishi himself was not able to resist his desire to go and see that girl. So he went in the midnight and knocked the door. That girl shouted from inside, "Who is there?" Jaimini told that I am Jaimini Rishi. Oh, whatever you are, whosoever you are, I am instructed by you only, Jaimini Rishi only, not to open the door. I'm not going to open the door. But then he told, no, no, I just want to see what is the arrangement, whether people have put water for you, whether you took your food or not. So I just wanted to see the arrangement inside. So please open and let me see that. But then this girl was adamant, no, I'll not open. Now, this person had so much of that urge. He pushed open the door. It was just hut and looked at the girl. And he saw that the girl was very beautiful, and he just asked that, "Will you marry me?" So all his brahmacharya and all went away, and that craving for having this girl was so much that he asked that, "Can you marry me?" Now this girl told कि okay आप तो बहुत ही महान है और मैं तो खुश हूँ आपके साथ मैरिज करने के लिए I'll marry you but uh, you make your face dark black color and come with me outside the town there is a temple we go there in the temple and we get married. Hmm? So Semini was so much in that sense of lust that he made his face dark, thinking that it's good. No, nobody would see me going with this girl at night. So he made his face dark, and then they went to the temple. And when they reached temple, suddenly that girl transformed into Guru, Badarayana. He was Guru, he was taking the test, he was trying to explain him that how strong this earth is. He became Badarayana and started scolding him that, see, look, now you see what you did. And Jaimini understood that, oh yeah, though I am following all the rules and regulations, this urge, this Kamadevas, this, Bana, they call it arrow that is so powerful that unless the person reaches to that level. So I told this story to this boy just to convey that, okay, in the last birth, you were man and perhaps you couldn't resist your this urge and you did that, which was very wrong. One should never do it. But then it's okay. It happened that time And not it's okay, but then you are given punishment. God is giving you the Palan. So as a result of that, you got this life as transgender and you suffered. But God is Suhud also. So if you do good karma in this life, and if you pray, so prayer will help you and do good karma in this life, whatever life God has given to you as a human being, and you be assured of good life in the next birth, and maybe your sins can be overcome by your prayer. Huh? See, it is said that prayer is an act which can generate a daivam. Daivam means Ishwar Anugrah, Ishwar ki kripa. So when you pray, you are generating that daivam, and God may forgive you in this life also and make you free of this. So whatever was conveyed to him in Akashic record reading, I try to uh, integrate and utilize that into a positive way because he was going in a very negative way, feeling very guilty and depressed. And that was the thing which I did. And the session was conducted with this prayer and resolution for doing good karma during this life, utilizing the opportunity given to him in the form of adversities and growing out of all the suffering, being more mature and a better person. So that way, developing resilience. So take it positively, your transgender gender state and your peaceful suffering. Take it positively, and you go through that, pass through that, and be more mature, more grown up spiritually. So there the session ended. I could see that beautiful smile on Rohan's face, and it's as if harsh, like all his guilt and the negative feelings subsided by these two explanations and the session at the end. But I'm going to, the entire presentation, I wanted to share my feelings as a therapist. What I felt very happy, and I was wondering that how come it happened that these two stories by Swami Brahmatmanandi and Swami Premanandi, I heard on the previous day only or in the last couple of days, and here there was an opportunity to utilize this knowledge. I was feeling so happy about it. Um, so this session with Rohan and the kind of feelings which I felt, it was really wonderful feeling. I consider it to be synchroned actually. The events happen for some purpose. So my listening to this and remembering the story and these things to the for giving to the client. So I felt very happy and satisfied. Of course, I don't know about the result outcome. I'll be telling you that, but that feeling of happiness, satisfaction developed in my mind. Another thing, during the entire session, when I was conducting that session, I felt merging of my ego boundary with the client, with Rohan's ego boundary, that merger kind of thing. I have felt this feeling earlier also in some cases while conducting some sessions with them. And I have found most of the time I have observed that that particular session, when I feel that merging of my ego boundary with the client's ego boundary, as if there is a oneness kind of thing psychologically, that has given a very good outcome. That has turned out to be a very positive turning point in the client's condition. That is what I observed in earlier cases also. So this kind of experience. gave me that satisfaction. Um, I wanted to know from Rohan about his feedback, but yesterday while calling him, I couldn't contact him. He's going to take his appointment next month. So whatever result will be there, I'll be telling you. But irrespective of the result, I wanted to convey by this presentation was, the kind of satisfaction which you get of doing something, utilizing your knowledge, skill, everything for helping someone to grow out of the suffering. That is something wonderful. Hmm? So always while working with the patient, I feel that uh, that kindness, that grace of God, that He put me in this work, where we are all fortunate enough uh, to have this profession, where we are working with the client to help them to grow out of their suffering. So that was the great feeling which I wanted to share with all of you. Uh, and I'll be sharing the outcome also in the next session. Now, this one more point I have put to the slides here. The PGDCH students have learned it as a theory of hypnosis. One of the theory, very, very old theory that was put forth in 1944. Very old theory, almost 100 years old theory. But I found this to be quite, I experienced that something like this happens. So what this theory says that hypnosis is reproduction of natural developmental process. So what is this natural developmental process and what is the theory? Let me explain you in next 2, 3 slides. Uh, during early phase of infancy, early infantile phase, the only sensory motor relationship of infant with the outside world is to the parents. So for this infant, whatever experiences are there of the outside world are this only. Parents are, trying to make him comfortable, make him happy, and all this kind of communication with the external world is there. For the infant, the entire world is this. But then, during development of the infant's ego, as the ego starts get formed, its boundaries gradually expand with the retention of parental images as unconscious incorporated components in the ego of the child. Hmm? So the ego of the child will incorporate these experiences which the child had as an infant uh, from the parents. And later on, these components in the ego of that person will continue in adulthood also. So this is some natural developmental process. Now, what happens in hypnosis? So, according to this theory, the process of hypnosis and ultimately fully developed hypnotic state, there are 3 phases. Phase 1, there is progressive elimination of all sensory motor channels of communication between the subject and the outside world. The subject who is going into trance, gradually the sensory motor channels start getting obliterated with the outside world, except between subject and the therapist. So finally, the therapist and subject, that is the only communication. The therapist becomes sole representative of an contact with the outside world. Hmm? So if I try to show it diagrammatically, something like that happens. There is an outside world in the client's mind, the therapist, and gradually there is obliteration of all sensory motor channels. So the client goes into the trance state where nothing bothers, nothing disturbs, except the voice of the therapist that enters. So this is something happened. So for the client, the contact remains with the therapist. It's like the infant developing ego, and as the parents um, incorporation of communication of parent directly, indirectly, all into the integration into the subject's psyche, ego. So that is something like this happens in stage one. This is what is explained in this theory. This is phase one. What happens in phase two? That is something very interesting. Then what happens? There is obliteration of the ego boundary of the subject. The ego boundary of the subject become little more permeable. It is getting obliterated, fading away. Obliteration of the ego boundaries of the subject with its fusion with the ego boundary of the therapist. And the suggestions of the therapist, the voice of the therapist become subject's own voice, subject's own thought. So that is what is happening for the client's ego. That whatever the suggestions are being given by the therapist, they become their own thought, the client's own thought. Hmm? So there is this kind of communication. So that will lead to, so there is a merger of the ego boundaries, and it leads to hypnagogic reverie with vivid sensory memories and images. They are released involving different modalities of sensation. So the vivid imaginations and this start coming in. And this opens the way to buried memories along with the suppressed memories, along with affects which are related to the such sensory memory. So the traumatic event, along with these buried memories, and it starts getting activated. And that is what to give insight to the client, insight to the therapist during the therapeutic session sometimes. And that is what is helping. So this is how phase three, this is phase two. But then in phase three, complete hypnosis, fully developed hypnotic state, what they say, there is partial re-expansion of the ego boundary of the subject. So ego boundary of the subject expands, incorporating a fragmentary image of the therapist within the expanded ego boundaries of the subject's ego. So this, whatever suggestions were given, they start getting implanted into the person's ego. That is how it becomes effective. Uh, and here, what I experience is from my point of view, as a therapist point of view, I have felt sometimes this kind of merger. I also felt as if there is merger with the client's mind. Of course, communication is from my side. There's no reverse communication, but that kind of sense, that kind of feeling. And whenever I get this feeling with any client, I have found most of it's just my observation, that session becomes very, very effective and turning point in the history of the client. So there is reproduction of natural developmental process. This is the theory, though it is very old and I don't know about its, there'll be counter arguments and maybe so many things have developed after that. But I see that there is some truth in this theory, according to my experience as the therapist. Not much discussed with the client, but with some clients who are, psychologists or they are they, they they are interested in psychology, reading is there. So with them, whenever I've discussed, they also have felt during the trance that yeah, uh, something like that. I was feeling that whatever you were talking, as if you are not talking, they are my own thoughts, huh? And they start getting implemented in my behavior, in my thoughts, feeling. And that's how that session became very effective for me. So this is what I have received as feedback also from some clients. Anyway, so here I complete my this presentation with a prayer for all of us that let our journey toward the ultimate goal continue. The ultimate goal is to achieve that whether we know it or we don't know. We want that happiness, that ananda, that sukha, which is permanent, which is absolute, and which is independent of objects, situations, and people. Independent happiness. Nitya, Nirbhela, Nirnimitta Sukha. That is the search in this journey of life. So, with that prayer, that let us keep moving on that. Thank you. Thank you very much. Thank you all. Thank you. Goodbye.